So we're going to go over Chapter 8 in your Fundamentals book, and it's on communication. How about that? How many times have we talked about communication? I think every week, right? Communication and the nurse-patient relationship. That's a little bit different. So these are pretty much your objectives. Communication. We've talked about this. Communication is one person's sending out information, the other person is receiving. It can be verbal, it can be nonverbal, it can be body language. It's a continuous circular process. Unless you're married to my husband and then he just does all the talking and I just listen. So again, verbal, nonverbal. Nonverbal can also be gestures, body posture. It can be eye rolling. Any of you that have a teenager know the eye roll, right? Different things affect communication, cultural differences. What are some things culturally with communication? That could even be personal space, right? Some cultures, they get right in your face and talk to you. Some cultures want a little bit more space between you and the other person. Past experiences. It could be maybe they grew up in a very abusive home, very verbally abusive. So their communication is either one, it's very timid and they're afraid to really speak their mind, or maybe they're very aggressive because they're so used to having to defend themselves that it's made them aggressive. Emotions and mood, that affects communication. I know that when I get really stressed, I can kind of snap without realizing it, snap at people, and people get offended, and it's not even, I don't even realize I do it. I'm like, what? What did I do? And as my husband likes to say, it's not what you said, it's how you said it. And then, of course, the attitude of the individual. You know, say, how are you doing? Fine. How are you doing? Fine. Different meanings, right? Same words. Oh, I already mentioned this, personal space and eye contact. Some cultures do not believe in eye contact. Um, our culture here, I say our as if everybody's same culture, we're not. A lot of the American culture is eye contact, that we do like to make direct eye contact. That makes some cultures very uncomfortable and some people very uncomfortable. Um, some cultures, they think it's rude to not agree with you. This is really important in a healthcare environment because you can give them instructions on their medication and say, do you understand? And they smile and say, yes. And really they don't. That's just in their culture, it's rude to say no. It could be even older people. Older people may not want to get instructions from someone young. You know, a real young person, they just may not want to be told what to do. And then, of course, religious beliefs take a part of this as well. And of course, that's how we perceive it is different too, based upon different things, culture and education and familiarity. So um, this is really big with healthcare. We need to make sure we speak to people in layman's terms. Um, you know, I've been around a lot of other healthcare professionals that speak to patients and use medical terminology. And um, you can see the patient's eyes glazing over. And a lot of times they don't want to say, what does that mean? Because they don't want to feel stupid. So of course they either agree or they answer questions that they have no idea what was asked. I absolutely hate that. I hate that when I see that. I usually work really hard to speak in layman's terms. You know, you talk heart attack or you can talk about a myocardial infarction. Well, people that are not in healthcare don't necessarily know a myocardial infarction is a heart attack or a CVA is a stroke. Um, so beware. You know, do you have dysuria? Do you have dysphagia? Well, most people don't know what that means. Dysuria, difficulty urinating, dysphagia, difficulty eating or swallowing. Um, So communication, be aware of who you're talking to and make sure that you speak a language that they understand. People that are really anxious and scared, especially if they're worried they have cancer or, just some sort of health issue, they're scared, they're anxious, they don't hear you. That's why it's always advised for people to, when they have pretty serious health events, to take someone else along with them. Just because the other person is going to be able to hear that person that's gathering the information or that it may be directed towards. They're so scared they're not hearing anything. Somebody that's upset may speak louder and may not even realize it. Depressed person may speak very soft and very quiet. And then again, their attitude may affect how that message is received. Active listening, I've talked about this a lot. I know several times, so I'm not even going to talk about it. Y'all should have it by now. I think, I don't know what this is. It's another video. Again, interpreting. Watch their posture, watch their gestures, watch their facial expression. Are they smiling? Are they frowning? When somebody's like leaning forward and listening to you, they're eager, they're engaged. The minute they lean back and start and cross their arms, they've closed off. They are not listening to you, and they basically are not happy with you. So, you need to see if you interpret a message correctly. Sometimes somebody has said something to me, and I kind of hesitate for a moment, and I will ask, what do you mean by that? Because what I believe is what they're saying. It may not be what they're saying. And there's been times that someone has said something that I've kind of taken, a little bit offense to, but I stopped. Instead of just snapping and jumping all over them, I kind of take a step back and say, what do you mean? Can you explain it? And most of the time, I misinterpreted the message. So think about that. Think about that not just professionally, but think about it in your personal life. Slow down, think about it, and ask somebody to explain themselves. And you say it in a nice manner, because you will be surprised how many arguments you are going to not have. Also, when somebody says something, it's good to repeat it back to them. Repeat it back. So, Mr. Smith, you said that you are having abdominal pain every time you eat. Is that correct? So you're repeating and back to the patient, and that is just getting clarification. Always stay focused. Keep attention. Don't start multitasking. Don't bring out your phone or your computer. You need to put it down. Pay attention. You can also, you need to what we call mirror. You mirror the person. If they're speaking kind of slow, then you need to slow down. If they're speaking fast, then you need to speed it up. Nothing's worse than somebody that's speaking slow and they're thinking things through really carefully, and then you're getting impatient with them. Okay, come on. What? That's very annoying, and it's rude and disrespectful. With communication, the big one that I don't think we've talked about too much in class has been therapeutic communication. Therapeutic communication is a type of communication that we as nurses use quite often. We basically allow the patient to talk. We repeat things back to them to make sure that we have an understanding. We restate the message. We clarify. We use silence. We use open-ended questions. Silence, that usually prompts other people to talk. And when we're doing assessments and interviews, we need them to be speaking. Therapeutic touch. That's, when someone's hurting or they're in pain, that's when we reach out and kind of like touch their arm or pat their back. Now, do be aware that some cultures don't want to be touched, but if you go to touch somebody and they pull away from you, then just don't do it again. But Majority of the population appreciate that. So, therapeutic communication techniques. You want to, of course, the big one here is also summarize. We already said you restate what they said. You repeat back to them what they said. Give them time to talk. And you clarify. If they say, I've been feeling really bad lately, you say, you've been feeling really bad? And then that will prompt them to say more. And always summarize. Summarize, what you've talked about. You always want to say, well, tell me more. Describe that. I want to know more about that. And again, that gets people talking. If you want to block effective communication, you don't want to have effective communication, this is what you do. Change the subject. They're talking about something that's important to them, and then you change the subject. That's a block. That means you don't care. That means you are not interested in what they have to say. Never give false reassurance. In a healthcare environment, someone has, some really bad news. Don't say it's fine. You'll be fine. First of all, you don't know if they're going to be fine or not. Second of all, it's kind of patronizing. It's not validating their feelings. I'm sorry goes a long way. Someone finds out they have terminal cancer and they're crying. That's where the therapeutic touch, rub their back, pat them, and just be like, I'm so sorry. That goes a long way. Let them talk. Don't give advice. Do not give advice. People don't want to get advice. Usually they just want to talk. They don't want to hear your thoughts and your opinions on this. Don't be defensive. Asking prying or probing questions. Now that one is kind of hard because we as nurses do kind of ask questions that normal people in society wouldn't ask. But just think about what you're saying and make sure it's relevant to what's going on. And listening inattentively. Again, that's when you're and looking around or looking at your watch or looking at your phone. They know you're not listening, and that is not effective. I think that's an example. You'll just have to watch that on your own. Okay, so here's a question. Andy's having difficulty communicating with his patient. His patient barely understands English, is highly anxious about being hospitalized, and doesn't look at Andy when he's speaking. Which 4 factors affect communication? Cultural, past experiences, emotions, and attitude, or age, attitude, language, and tone of voice, or style, cultural difference, experience, and mood, or focusing, style, cultural differences, and past experiences. Well, it's number 1. We just talked about that. Cultural differences, past experiences, emotions, and attitude. Tone of voice can be kind of, towards mood, but the 4 factors are the first. All right, question number 2. Holly is trying to encourage her patient to elaborate rather than replying in short 1 or 2 words, 2 answers. Her patient relates to Holly that she doesn't feel safe at home. Holly replies, "Would you tell me more about this?" This is an example of what type of therapeutic communication. So is it encouraging elaboration? Is it restatement? Is it an open-ended question or clarification? And it is an open-ended question. So she's saying, will you tell me more about this? The patient can't say, well, I guess they could say, it's fine, but for the most part, that will prompt the patient to explain and to describe what's going on. All right, question number 3. Marisol's patient is diabetic. Marisol notices her patient eating cheesecake and a cola from a visitor and states, "I don't think that is a good thing for you to do, considering you have diabetes." Yeah, don't do that. We don't do that as nurses. We don't go, "Oh, you're diabetic and you're eating cheesecake and drinking a Coke." This is an example of which block of communication? Changing the subject, judgmental response, defensive response, or giving advice. And it's a judgmental response. You're judging. Your job is to educate the patient, let them know, but if the patient chooses to eat cheesecake and drink a Coke, then that's their business and we don't judge them. All right, question 4. Emily's patient is very nervous about her surgery. She's having a breast biopsy. Emily tells her patient, I'm sure it will turn out fine. You don't need to worry. This is an example of which communication block? And it's number 2, giving false reassurance. She's nervous about her surgery. The nurse says, hey, it'll turn out fine. You don't need to worry. Well, you know what? You don't say that to somebody because you know what? You don't know. And what if things go wrong? You've just broken the trust with that patient. All right, these are some. Okay, interviewing skills. My goodness, I feel like we've done this quite a bit. Establish a rapport. You want to develop that nurse-patient relationship. You want to show empathy, non-judgmental, maintain hope, truth-telling. You want to use the nursing process and nurse-patient communication. This is all stuff that we talked about over and over again. Okay, talking with the hearing impaired. This is a big one, and I'm not sure if we've discussed this. We get a lot of hearing impaired, especially we get older adults. You know, if you work in a nursing home or rehab or in a hospital or even a doctor's office, majority of your patients or the residents are going to be elderly, and most of them are hard of hearing. You need to speak very distinctly. You need to enunciate your words. You need to speak slowly. You need to make sure you have the person's attention. You should be in front of them so they can see your face, because often people somewhat read lips. You need to, a lot of times people lose hearing with higher frequencies, so you need to kind of lower your voice a little bit. Don't go in and go, hey, Mr. Smith, how you doing today? Because Mr. Smith's not going to hear you or understand you. He's going to hear like Mickey Mouse or Minnie Mouse. My dad used to say that. Why are these people coming in here speaking like Minnie Mouse? And I can't understand them. And it was because for some reason women would come in and just, oh, hi, how are you? Well, when somebody has hearing loss, especially when they're older, they can't hear that. And then they'd be like, oh, he's hard of hearing. So then they would yell at him, and he would get so mad. Why are these people yelling at me? So to me, it was just like, okay, well, apparently they do not know how to speak to someone hard of hearing. Slow it down, kind of, and I'm not saying, oh, go to a deep voice, but don't have a real high-pitched voice. You want to have it to be a little bit lower. That's why typically people that are hard of hearing can understand men, but they can't understand women. So women, kind of, make sure your voice is a little bit lower. Again, speak slowly and enunciate your words. Be in front of them so they can see your mouth move. And this is how we speak to people that are hard of hearing. Now, if they're completely deaf, you might want to even get a whiteboard and write. You can write. Aphasia. Aphasia. Do y'all know what aphasia is? Aphasia is not being able to speak. A lot of times stroke patients can have either receptive or expressive aphasia. Receptive aphasia means they have lost the ability to understand what you're saying. So you're talking to them, but they cannot understand. They don't understand what you're saying. Expressive aphasia means they cannot express themselves. They cannot speak. They try. A lot of times it's like, it is horribly, it's just horrible. And you feel horrible for them because they get so frustrated. They get so angry. So often, a lot of facilities will have little boards that they can even just point to. Like if they want, they can point to a drink or food or point to the bathroom, a toilet. So they use these picture boards, or just get a whiteboard and a marker and let them write what they need to tell you. If they do have hearing aids, make sure they have access to them, that they can have them in. If they have visual deficits, make sure they have their glasses, or sometimes they'll have visual deficits that you need to talk through. Like if you're bringing them their food and you have a plate, you set everything up for them in front of them and let them know your fork is to the right, you have Jello on the left, your plate, you have turkey at the 12 o'clock position, you have peas at the 3 o'clock position, you have applesauce at the 6 o'clock position. Describe it to them like a clock and let them know where everything is. Slow down when you're talking to especially older people. It takes them a little bit longer to get the words out. And if you ask them a question and you ask one question after another, do you need to go to the bathroom? Do you need to, do you need to want something to drink? Do you want some Coke? Do you want a sandwich? They're just going to look at you because you're not even giving them a chance to answer. Ask a question and wait for them to answer. Children, communicating with children. It's best to get down on their level. Get down, squat down, be eye level. You're standing up over them, talking down to them. That's intimidating to them. When you speak to a child, you should be getting down, squat down on your knee, and be eye to eye with them. Use a calm and friendly voice. And usually want to make sure the parent is in the room, if possible. You want to speak very short sentences. You want to give simple explanations. If you let the child play with the equipment, say you need to listen to their heart and you have a stethoscope, you might want to hand your stethoscope to them and say, here, let them put it in their ears and let them listen to your heart first. Here, listen to mine. Do you hear my heart? Wow, isn't that cool? Here, let me listen to yours now. Or let them listen to their own heart. Children get scared very easy. You make sudden movements, it could just startle them. So just approach them very, very carefully, be very, like I said, very friendly and smile. And, if possible, let them handle the equipment that you have so they can see that it's not going to hurt them. Again, with older adults, always determine the language. You should determine the language spoken with anyone, older, young, whatever. If you do not speak that language, get an interpreter. You can enlist the aid of a family member, but it's best to get an interpreter. Often, facilities will have like instructions, and they'll have where you can print it out. They have many different languages, so you can print out materials in the language that person speaks. And then again, be aware if they're of a different culture. Be aware of what let them lead. Do they look you in the eye? Are they okay with you being close? So just pick up on their cues and follow. And then again, here's all the lovely notes, and we talked about that. Was on the last PowerPoint was documentation. Nurses' notes, physicians' orders and notes, OT, PT, speech therapy, dietitian, radiology, lab, they all put in notes. Into shift report. We have not talked too much about shift report. Walking rounds, that's usually done once a day, and it's often with the physician. And sometimes it's a group. There's sometimes like 4 or 5 people. They walk around in a group and go from one room to another to see the patients. And sometimes you'll have the pharmacist right there with you. You'll have the patient's nurse. You'll have the physician. You may have a nurse practitioner, and it's a whole group. And basically they're collaborating. Okay, here's Mr. Jones. This is what's going on. Now you've got all the people in place that can collaborate on what Mr. Jones needs. So it's actually pretty cool when you do walking rounds. Shift reports, we often do them in an S-bar format. S as in Sam, B as in boy, A as in apple, R as in Robert. S-bar. It's basically gives the situation, background, assessment, and oh gosh, here's videos again. I'm sorry. Oh, and I love this guy. You guys got to go and watch his this video. Go back to the PowerPoints and the announcements that's not recorded and watch this video, because if you haven't seen videos from this guy, shoot, I forgot his name. Blake, Nurse Blake. He's hilarious. Let me see. Oh, so a lot of times we have to contact the physician. Now, I said in some facilities now we have a nice little texting, which is awesome. But if you are in a facility where you need to contact the doctor, make sure you got all your information in front of you, because I guarantee you they're going to ask you vital signs. What's their blood pressure? What's their pulse? Make sure you have it on hand. Think about anything the doctor could ask and try to have it in front of you, because you don't want to go, oh, I'm not sure. Doctors do not like that. So always have everything. Tell the doctor exactly what's going on. Hi, my name is blah, blah, blah. I'm the nurse for Mr. Mr. Jones in room blah, blah, blah. He hasn't been able to have a bowel movement in 3 days. I was wondering if I could get an order for some sort of, maybe a laxative or something. And the doctor may ask some questions, blah, 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 and then they'll put an order in for you. So then you go in and document in the notes, in your nursing notes, called the physician, inquired about patient not having a bowel movement in 3 days, doctor is placing an order for a laxative. Where are we? Assignment considerations and delegations. So you can delegate tasks. Now, if you delegate a task to someone else, you are still responsible for it. So you need to make sure and follow up to make sure they did it. If you as an LPN delegate to a CNA, you need to make sure that they did the task. If they didn't, it's still your responsibility. You are the nurse assigned to the patient, and the CNA didn't do it, you're the one that's accountable for it. Okay, so with the computer communication, now we do use the computer. We use it to put in orders, and we do requests. We can put in like dietary requests, like a lot of times you can send like a message to different departments, to dietary. Hey, this patient was off the floor having a procedure done when dinner was brought. Can you bring up a tray now? You can do all that through the computer. You can put in orders for supplies. You're running out of supplies. You can place orders through the computer. Each facility you work in has a different process for that, but typically it is done with the computer. Yeah, not so. We'll talk about that. Okay, last slide. Sarah has just graduated from nursing school. She realizes all of the following statements are true regarding communication, except the ability to use a computer for communication is essential for today's nurse. Okay, I think that's true. When communicating with a child, you should speak loudly and maintain an even tone so the child can hear you. Okay, children are not deaf, so no. When you speak loudly, you're going to scare them. They're going to start crying. Let's see, the next one says phrases that tend to block or terminate communication should be avoided. That's true. Giving an organized, efficient, end-to-shift report is an important communication skill for nurses. Yes. So obviously the answer here is the communication that you do not do is speaking loudly with a child. Okay, that's it for communication. And if you have any questions, reach out to me. Thank you. Have a good night.